We have been talking about Aaron DERFEL's I guess, what are we now? Part 3 series, the 3 parts on the Lakeshore General Hospital, which started with some unexplained, what are called sentinel deaths, and the fact that it took people there who had already, call them whistleblowers if you want, raised this to the government and then found that nothing had been done. There was the story of a suicide of a former SQ officer and then some other unexplained deaths, which highlighted just how tragic the conditions have been and are, apparently, at the Lakeshore General. And then today's piece on Francois Legault's mother, who was admitted to the hospital there, and exactly how things turned around so that he couldn't see what the real condition of the ER at that hospital was. Now, Aaron DERFEL is on the line. And Aaron, I want to begin by pointing out, and I think it's important to say this right off the top, we are not talking about the fact that Francois Legault was aware of any of this, right? Just the fact that his mother had been admitted, and the picture that he got to see of how she was being treated was very different from what anybody else who'd been admitted was going to get in terms of the way they would be treated.
Precisely. So there's nothing that, I found to suggest even remotely that the Premier or anyone in his entourage used their influence to secure better treatment, for Legault's mother. The question here is that it was some of the staff who took it upon themselves, likely at the direction of a senior manager to very quickly transfer his mother out of what would have been the worst bed, what was the worst bed in the ER, to the relatively new annex next door.
By the way, can we just explain what this annex is? Because this is part of the story, an integral part of it. Explain what the annex is.
So the annex is something that was built exclusively, for the pandemic. It was intended for COVID-19 patients, these so-called negative pressure rooms, and at a cost of $12 million, these prefabricated units. One was also built outside St. Mary's Hospital. Unfortunately, they have never been used as COVID-19 units. So instead, since they have them, the staff call them, a white elephant. Since they have them, they have to use them for some purpose. At the Lakeshore, what they use them for primarily is for stabilized ER patients who are going to be admitted to an upper floor or who are going to be discharged soon. So usually it takes a few days to go from being in the ER to getting into the annex. And in the case of the Premier's mother, that happened in less than 24 hours. And what that would have meant, and again, this would be unbeknownst to her or the Premier, what that would have meant is that patients who should have gone into that annex sooner, at least one patient had to wait a little bit longer because the Premier's mother got to go jump the queue, so to speak, a little bit earlier. Again, this was not at her behest, but this is what was being done behind the scenes.
Right. I can't help but question the motivation. Like, what would be obviously it's got to be shame and fear of getting in trouble, but in terms of what would be more effective, in reality, they should have allowed the Premier to see and to have his mother experience how bad it really is, and then perhaps something good could come of this, Aaron.
Well, this in a sense recalls a little bit what happened at the Heron residence, because at the time, horrible things were going on, but the upper levels of the government was not made aware of just how bad it was, and so this is sometimes what goes on at the institutional level to shield the higher ups from the reality, and so. There's no doubt that when the Premier visited the Lakeshore to see his mother, as any good son would, he had met with staff. He's trying to figure out what was going on. But the question is, again, was he given the full picture? Because if it was anybody else, if it was anybody else's mom, the son would have to spend that time right in smack in the ER, as opposed to a gleaming white facility next door.
Yeah, well, you could make the case, I guess, that someone in his entourage would have been, as Natasha said, would have been much smarter to take him through, and then he could have addressed the situation. He didn't get to see it. I get it. But you must at least take some satisfaction there in the fact that a day after the article appeared, boom, the provincial government decides an independent inquiry is going to be launched.
Yeah, and that's actually the much bigger story here, which is that First of all, the Lakeshore is not the only ER where that's under tremendous pressure. So under-resourced, understaffed, overloaded with patients. And in this context, to err is human, these medical mistakes are being made, and sometimes patients are dying. Provincially, the number of ER deaths has increased by nearly 8%, in the past 4 years. At the Lakeshore, it was 18%, much higher. And so this investigation is going to look into the deaths and what's been going on at the Lakeshore. But the question is, perhaps it could be expanded, to other ERs as well.
We're into part 3 here. What's the next thing that you have coming up?
Well, the next part is sort of like the roadmap, I guess. I couldn't possibly anticipate that the provincial government would launch an independent investigation so quickly. But part 4 looks at the root causes of this crisis, really, which has been decades in the making. They're building a brand new hospital in Vaudreuil-Dorion, which is great for people who live off island. But the Lakeshore is stuck with a hospital that was built in 1965. The ER has been renovated in decades. Over the years, lots of seniors' residences have opened up around that area, and there are these structural problems. It needs to be renovated. They need to get better equipment. They need better training. They need more support. So the government has. It's not just a question of goodwill. The government has to really. It has to follow through with funding to build, a state-of-the-art ER. Because right now, one of the code rooms that's used to resuscitate patients, they can't even properly see it because it's off to the side. Because this layout, this was never intended. This ER, when it was opened in 1988, it was never intended to be a permanent feature of that hospital. And so these are ultimately these lingering questions, and that's what part 4 tomorrow is about. It's the root causes of this crisis, really, which was decades in the making.
I'm curious, one other thing, too. You mentioned this annex, and I don't want to keep getting back to it, but equipment there that's like state-of-the-art that's just sitting basically collecting dust. So when you point something like that out, and we know you obviously have the government's attention here, my concern, I mentioned this earlier to one of our commentators, was the fact that, okay, great, they've tabled this, or at least, the idea that there's going to be an independent inquiry, and then it'll just sit there and nothing will happen, and we're back where we started from, and nothing will change.
Well, that's such a great point, Aaron, because the issue here is that there was that coroner's inquiry into the heron, and steps were taken, but months later there were all these horrible reports about Les Floralie, the residents there. So the question to be asked is, fine, there will be this independent investigation, and then what will they do? And so what my role is as a journalist is to continue to follow this closely. And if they do nothing, to point it out.
Thank God you've done this. So again,
Absolutely.
Investigative series on the Lakeshore ER. I just want to say thank you, Aaron, for doing this important work. Thank God for local journalism. And then on a personal note, I just can only imagine how hard it must be day in and day out to do this kind of work, and how frustrating it must be for you to see up close how broken the system is.
Well, yeah, that has been. That sometimes has been hard. The first installment of the series was on, the suicide of a retired Surgery Quebec officer. Mm-hmm. I'd spoken to his son, and you go over all the details, right? It's just, it's so emotionally wrenching. And then these other deaths under very, highly controversial circumstances. A patient coming in, they need to replace a catheter. The patient comes in, there's clearly on the medical file, not by mouth. That means no medication, no food, no liquids by mouth. And in the turmoil and chaos of that ER, because they're so distracted, they're so overloaded, not properly trained, there's no supervision, somebody gives this patient a mixture of applesauce and medication by mouth. The patient then aspirates, develops pneumonia, and dies. They feel horrible about it, but, these whistleblowers, these nurses, and other sources, they tried to resolve these things internally. They felt nothing was done. Then they emailed the provincial tip line. Nothing was done. Then they appealed, in at least 3 of the deaths to the health minister's office directly. they got an acknowledgement of receipt, but no follow through to inquire, what are some of the details. So that's really when, they decided to speak to me so that I could, put it all together in this package that I wanted to be very strong and shocking to sort of jolt the authorities into action.
To one last question, I know we're late here, but with respect to, you're talking about, Natasha asked you what it was like for you. When you heard from all these sources, right, who spoke to you but couldn't speak to anybody else, I can't imagine that they had to turn to you for everything they had done, everyone they had tried to contact to point out what was wrong, and the tragedies that were occurring there got them nowhere. How relieved were they that they actually had someone they could go to and tell their stories to?
Oh, well, now they're very thrilled. They're very, very thrilled, Like one, just to sort of let you know, tomorrow's part is going to be put on an instant paywall. And so one of the sources said, that they're going to buy a subscription just so they can access that.
Okay.
So it's a nice feeling, and that they feel that their message was received.
Good for you, and great work, as Natasha said, and keep it up. Finding out all these things and taking great pride in the fact that the government is at least beginning to listen now. Aaron, thank you so much. Appreciate it.
My pleasure.
Take good care. Aaron DERFEL of the Montreal Gazette. Yes, part 4 of that coming up tomorrow.